So let's now move on. That's money for you, and some of the challenges. Let's now move on to well-being and life satisfaction. And these are just some references that might be relevant if you're interested to follow up. Okay, willingness to pay and well-being valuation. Willingness to pay, if you try to describe it in more theoretical terms, willingness to pay essentially focuses on expected utility. Well-being is a different approach. Well-being emphasizes people's experience of a condition. So an example of a well-being question in general is, all things considered, how satisfied or dissatisfied are you with life, your life overall, using a scale 1 to 7? Now, if somebody stopped me in the street and asked me this, I think I would burst out laughing. But this is probably the most common wording of the well-being question. All things considered, how satisfied or dissatisfied are you with your life overall? 1, very dissatisfied, up to 7, very satisfied. Life satisfaction is seen as being a sort of mix of positive and negative emotions, and also some cognitive assessment of how well your life measures up to your expectations and your aspirations. There are clearly quite a few challenges with this sort of approach, particularly this emphasis on thinking how things are going, thinking about past experiences. You can have a peak end bias. If people are asked to cast their mind back and make an overall view about how things went or didn't go, sometimes we'll just focus on the peaks. Or some evidence, it's what happened last matters. There's some very famous studies conducted during labour, before, during and after labour with women, and it's trying to investigate their attitude and interest in pain relief. And as you ask the question at different points, you get different answers, for one thing. Maybe at the start, people might be saying, no, I'm not too interested. And then, of course, into labour and pain relief becomes a bit more interesting. And then, of course, after the event, they then think, well, it wasn't so bad. They think about the end of it all, and it was sort of okay. And the bit in the middle, which was a bit awful, kind of doesn't feature. So that's a bit of a problem. As we start, any measure that's beginning to focus on people's experience, in some ways there's a sort of unreliability can creep in. Another issue is what's labelled here as context effects, and studies have shown just how important your current mood is. So if you're asked about, so how are things going? You know, how have the last 3 months been for you? If you catch someone in a sort of good mood, it's all, yeah, it was fine, yeah, it's good. Catch them in a bad day, it's the same last 3 months they experienced, but they just got a different way of describing it, an attitude towards it. Another problem, another challenge with asking about life satisfaction is that for many people, there's a sort of socially desirable answer. If people ask you, how satisfied are you with your life? It doesn't really, the first thing that comes to mind is, or isn't, or I'm really dissatisfied and I want to tell you about it. That doesn't sort of, you come across the wrong sort of individual. It's much more likely that if you're very dissatisfied, you'll be a bit more neutral, or you might even go beyond neutral. You might be a little bit positive in your statement. And it's because there's a social expectation that it's good to be satisfied, it's bad to be dissatisfied. I want to project good, I don't project bad.
This is very cultural.
Yes, not all cultures, yes, yeah. You give an example?
Well, in Japan, it's better not to be more satisfied than the person next to you.
True. This is also a Swedish thing.
Yes.
Yeah.
You come back from vacation, how was it? You dare not say it was wonderful, because no one else is going on vacation. You say it was a lot of work, there's a lot of trouble, I'm glad to be back. Then nobody else is jealous.
Okay. So in different cultures, the direction could be quite different, but the kind of phenomenon that there's a social pressure to respond in a particular way is there, yeah. On the other hand, I mean, so these are definitely potential challenges, but if we are focusing on life satisfaction, there's clearly advantages as well. If the sort of questions that enabled us to score things were as simple as this question, collecting data is just such a low-cost activity. Could we not just do it on send SMS messages and, you've collected your data in an afternoon. So it could be quite cost-effective in terms of data collection. Wide application, it's everything, life satisfaction. So that's good. Some proponents would argue fewer biases than the alternatives. I think the jury might be out on that one. Here's an actual study. The proponents, I think the authors are on the next slide. Maybe not. I hope I've credited them somewhere. I think it was Paul Dolan. He or they had a hypothesis that the sorts of things that get weighted highly in a health scale, for example, EQ5D, are different from the sorts of elements that will have a high weighting if we use life satisfaction or a sort of day equivalent. And he or they have used this to argue, therefore, the EQ5D is wrong, and it's the life satisfaction and day effect that's right. And so to do this, they had data, well, it was the data that was collected in the United States, valuing the EQ5D using time trade-off. They then, from another study, had almost 1,200 respondents who were asked life satisfaction and day effect questions, and then they tried to understand why people gave high or low answers. And so what they found was, well, these are the questions. Life satisfaction, overall, how satisfied are you with life? Scored in a scale 0 to 6, then rescaled 0 to 1 to make it a little bit more like an EQ5D, which of course is 0 to 1. And they also had the day effect question. It's a little bit more complicated. Overall, how did you feel yesterday? Please rate each feeling on the scale given. A 0 means you didn't experience the feeling at all. A 6 means you experienced that feeling very strongly. And then you're asked about these, friendly, lethargic, stressed, happy, sad, calm, angry, tired, depressed, worried. And the score for day effect is the difference between the average of the positives and the average of the negatives. So I could ask you just to check you're paying attention, which are the positives, but I won't.
There are a lot more negatives than positives.
There are a lot more negatives, but they're using the average. So the average positive. So you've got an average score for friendly, happy, calm. Yes, that's it. And you've got an average score, lethargic, stressed, sad, angry, tired, depressed, worried. And then you look at the difference between the average positive and the average negative. So in principle, if things were just wonderful, you could have a score of 6. That's if you scored all 6s for friendly, happy, etc., and all 0s for lethargic, angry, etc. And the other way around. You could have a -6 score. And so that raw data, as it were, is then rescaled to 0 to 1 as well. So 0 being sort of bad end of things, 1 being the good end of things. And so then the precise numbers don't matter here, so don't worry about size of it. So the first column is taking these EQ5D time trade-off scores and trying to explain them in terms of the different dimensions. The second column is taking the life satisfaction, overall how satisfied are you with life, and trying to explain it using the same dimensions. And then the day effect, doing the same thing. And so what they found was quite interesting. In the EQ5D, things like mobility are really quite important, but having no effect on life satisfaction or this day effect score. Self-care is quite important for EQ5D, but no effect, life satisfaction or day effect. A bit more, as it were, agreement when we get to things like usual activity, a little bit, but pain and anxiety and depression. It features in the EQ5D and features strongly in life satisfaction and day effect. And so this is used as evidence that using things like life satisfaction is going to pick up something different from what you pick up with an EQ5D. And more than being different, these authors would argue the life satisfaction is the sort of more correct, whereas EQ5D is less correct. But how you can argue it, but how you can make your case is not so obvious. But let's just say that it does suggest life satisfaction or day effect is probably tapping into something different from what you'll pick up with a preference-based genetic measure such as EQ5D.
Antonovsky's sense of coherence research would suggest that some of this life satisfaction stuff is programmed into us by the time we're 20 years old, and it's not adjustable by medical health interventions. So when you look at life satisfaction, you're looking at attitudes towards your situation rather than health situation.
Right, which could then cause a bit of a problem if you're going to measure changes in life satisfaction in apparent response to healthcare intervention, because you're not going to get much change. So potentially some challenge there.